I recently became aware of some online reviews concerning patients that did not get the results that they were looking for from hairline lowering surgery. This is, of course, very concerning because it paints a negative picture on a very, very successful procedure. Patients are generally very happy with the results of hairline lowering surgery. There's some important considerations that we use during the consultation to help patients predict what they're going to look like after the procedure. The scalp laxity, which is extremely important when deciding to do a hairline lowering surgery, is discussed in detail during the consultation. On my website, I discuss exactly what this means, but I also discuss it in the consultation and show you exactly how far the hairline can be lowered based on the scalp laxity. I'm usually able to predict this within millimeters of the final result. Typically, I'm right on par with an exact measurement, but sometimes I'm a millimeter or two short, or in fact, sometimes it's in the patient's favor where I can even go 1 or 2 millimeters farther. It's unusual and unheard of, really, that I wouldn't be able to get the amount of hairline lowering that I promised the patient. Anyone getting less than 2 centimeters of hairline lowering would know that before the procedure. We typically would show you in the mirror exactly how far the hairline can be lowered, and if the hairline can't be lowered by 2 centimeters, typically we discuss the two-stage procedure, which would include the scalp expander, or performing a hairline lowering surgery with additional hair transplantation, either at the same time or at a later date. So there really are no surprises with hairline lowering surgery. That's one of the nice things about it. Patients can typically predict exactly how they're going to look afterwards. Of course, there's no way to give you an exact picture of what it's going to look like, but we do draw the line in prior to the procedure, before you're sleepy for the procedure, so you can see exactly where the hairline is going to come down to, as well as you can play with it at home as well, just by shading it in with an eyebrow pencil, just to see how low you want the hairline to go. And when you come in for your consultation with me, I go over in detail whether I can get down to that level or not, and we take accurate measurements at that time. So I'm not exactly sure that I understand why anyone would be surprised by the amount of hairline lowering that they were able to get after a procedure with me, because we do take extremely long amount of time to discuss exactly how far the hairline will be lowered. Um, Anyone who gets a smaller amount than they desired from hairline lowering surgery might be disappointed, but unfortunately, I would never promise that someone's hairline would be lowered more than I would think based on their scalp laxity. So if a patient wants 2 centimeters or if they want 3 centimeters, it doesn't mean that that can actually be done by me or by any surgeon who performs hairline lowering. If the scalp laxity is not enough, additional hair transplants would be needed or a scalp expander would be needed. It's really just not enough for a patient to want something in order for the surgeon to be able to do it. I perform the hairline lowering surgery, I think, amongst the best of the surgeons in the country. And if I can't get your hairline lower than you know than you wanted or to the level that you wanted, it wasn't because this was a surprise. So unfortunately, sometimes online reviews paint a negative picture on a procedure that's highly successful. In fact, one review can really ruin a patient's perception of this procedure. What I promise all of my patients is that when you come in for the consultation with me, we will give you a very accurate depiction of what amount of hairline lowering you can get. If you want 2 centimeters, but I tell you that only 1 centimeter is possible, you should expect to only get 1 centimeter. If you only get 1 centimeter, then I would expect, even if you're disappointed by that, that you would not paint a negative picture on me or any other surgeon if they already informed you that 2 centimeters wasn't enough. I think I've proved, or I think I've discussed this point in detail enough, but unfortunately, this, like I said, has painted a negative picture and made people worry unnecessarily about such a highly successful procedure where patients are so happy afterwards. It's such a satisfying procedure, and hopefully patients seeing this video will have a better understanding of what that review really meant.